The motivation for this present study was, that there were several children, who went through the cochlear implant, do have an experience of dizziness, following cochlear implantations, and it's also noticed that they do have either the vestibular dysfunction or the hypofunctions, as per the CVEMP abnormalities in cochlear implantees when it was compared with the normal hearing. But the reported literature was on unrectified WEMP, which is highly variable and that has less reliabilities. And we do also realize that there are no known literature that whether all surgical approaches affect Saccular. With these motivations, the present study aimed was to find out the effect of cochlear implantation on Saccular function and the differential effect, if any, of the surgical approaches on CVEMP latencies as well as rectified amplitude. So there were 40 participants, 20 in each group, unilateral cochlear implantations using a mastectomy approach as well as the Varia technique approach in the age range of 3 to 6 years. All these 40 participants were having structurally normal inner ear and eighth nerve complex, and they underwent CVEMP a day before CI surgery and the day after switch on. And once we completed this CVEMP test, we tabulated the data and separoville test of normality was done, and it was realized that its data is not normally distributed, and hence Wilcoxon rank and Mann-Whitney test was performed. We could able to see that there is no significant differences in terms of latencies, whether it is non-CI ear versus CI ear, or between two approaches, whether it is a mastectomy or Varia technique. But we could able to find out quite interesting finding, that is there was a significantly lower amplitude after cochlear implantations than before, as it is reflected here in this particular graph. You can see the pre and post CI, there is a significant differences whether you talk about both the approaches, whether it is a mastectomy or Varia, as well as even in the non-cochlear implant ear, there is a differences. So why there was a poor CVEMP amplitude, and that too is in implanted ear. So literature gives us some indications that possibly it could be due to the traumatic electrode insertion that could have resulted in saccular membrane distortion or loss of saccular membrane or saccular collapse or hydrops or local fibrosis, or it could have resulted obstruction of the ductus reunions by the debris while performing a CI surgery. The another interesting finding was why there was both surgery approaches affected saccular function. So literature says that the drilling which is involved in the CI surgery of the temporal bone could have caused the saccular dysfunction, as vibration induced saccular dysfunction is observed in many cranial surgeries. So to conclude, it gives us an indications that there is a possibilities of saccular damage, which is a prominently evidence after cochlear implantation. And the outcome, the good thing is the outcomes are independent of the surgery technique, whether it is a Varia or mastectomy. At the same time, the CVEMP before and after CI probably will help in identifying vestibular dysfunction in children, and could be used as an indicator for the need of initiating early vestibular rehabilitations. Thank you.